if you have a lot of tension in your neck and your shoulders, or you've been noticing your posture is a little bit forward, or someone has told you that your shoulders have a more forward position, you may have been told, or you may have been suggested to you they have tightness in your pectoral muscles, especially your pectoralis minor, and it might actually not be true. It's a very common posture analysis interpretation to see a forward shoulder and assume that it means tightness. However, there's a lot of other reasons for this, but the best way to know for sure what's going on with you is to test yourself. So we can look at the length of your pectoralis minor like this. So laying on your back, you can palpate the back of the acromion, the posterior aspect of the acromion, that bony prominence. See how far it is from the table. We want to see it about an inch away. Anything more than that is considered excessive, although that 1 inch isn't absolute. It depends a little bit on the size of your body, but if it's especially more forward than the other side, you might think it's tight. Then we can look at pec major with hands behind the head and see how easy it is for the arms to rest on the table. And you can also assess this slightly different angle in a cactus arm position as well. Again, seeing if your arms reach the table. If they do, then you have good flexibility of the pecs. Then pec minor is also stretched when we're up overhead, especially at about 135 degrees of abduction, so at this Y-shaped angle of your arm. And again, if your arm easily touches the table, you can be assured that your pec minor and your pec major, at least portions of it, have enough flexibility. We're just watching out that we're not hyper abducting at the shoulder, so that your shoulder blade is down and we're stretching the chest and not the shoulder joint. And then more advanced, if you really want to see how far it can go, we can come to the edge of the table or lay on a foam roller and then bringing the arm up to that cactus position to see how much flexibility you have, and then being mindful that the ribs do not come with you as well. So once you've done the test, you'll have better information about what's going on with you, particularly if you're hypermobile. It's very common to feel tension in your neck and shoulders or to have forward shoulders, and you may be randomly given pectoralis stretches to try to address it, and you're not getting anywhere. So then this way, once you do the test, you'll be able to know for sure if that is something worthwhile for you to do at all. And in fact, most of the times, the tightness that we're feeling isn't because of limited flexibility. It's due to other reasons, neurological, postural changes that have to do more with our muscle strength and in our awareness, that take additional interventions to properly address rather than just stretching. However, if it is a little bit tight, then you know, okay, then it is tight, it's limited, I can do some stretching and see if it helps. You want to do the stretching the right way, and I have some other videos on that, especially if you're hypermobile. We want to stretch in a way that actually lengthens the muscles and not the ligaments, so stay tuned. Check out my channel for other videos on that. And if you found this helpful, be sure to leave a comment and subscribe to my channel for more information.